Hey there, and welcome to my newest edition of And Just One More Thing. Today, we're going to be talking about a specific program within our vast Santa Clara Valley health system, and that is our cancer program. We actually have two cancer centers in our system, one at the main Valley Medical Center campus and one at O'Connor. And the reason that I wanted to share this is in part because I think many people don't know that we have this very, very high-end specialty service. And it's part of really helping to expand the public's understanding of just how comprehensive our health system is in this county. So stay tuned for lots more to come. I am back. I am really looking forward to talking to my guest this morning, Dr. Nam Cho. She is the medical director of the Sobrato Cancer Center at Santa Clara Valley Medical Center. She also maintains an academic affiliation as a clinical instructor in the Department of Radiation Oncology at Sanford University School of Medicine. She earned her MD and PhD in biochemistry from Stanford. Completed a residency in radiation oncology, and then an internship in internal medicine at our very own Santa Clara Valley Health Center. So hang on, and we will have a great conversation with Dr. Cho in a moment. And I am back with Dr. Nam Cho. I'm going to share a little bit of her very impressive background, and then we're going to get into some conversation. You are clearly an accomplished physician scientist and leader in radiation oncology, cancer care, and infusion services, currently serving as the medical director of cancer and infusion services for Santa Clara Valley Healthcare, overseeing comprehensive oncology care across the county since 2022. So, and you mentioned before the camera started rolling that you work in a basement with a linear accelerator and all sorts of equipment, which I'm very interested in hearing about. But I kind of want to start with the big picture that I don't even think that the broad public in our county knows that the Valley Healthcare System has a specialty cancer center. So let's start with whatever kind of history you know about that center and how you ended up in the basement with extraordinary machines and equipment.
Wonderful place. Actually, I wish I could show off our cancer center to everyone. And at any opportunity I have, I love having people come to see, because it is, I think, not the kind of place anyone wants to willingly go to.
Sure.
Obviously, cancer is a devastating diagnosis for any individual and their family and their wider circle. But when you are diagnosed, you need top-notch care. And so why I love showing it off is because we have top-notch facilities, and that's something that I really appreciate from county leadership, is really this real belief that when you are sick, when you have something as serious as cancer, you deserve the care that you'd want for your own family, like that I would want for my own family, and that it shouldn't be that you have that your chance of beating this cancer or of having a successful outcome is any different, regardless of where you're coming from, who you know or how well connected you are. And that to me is important.
You trained at Stanford.
Yes.
And chose to come work in the county hospital system with tremendous respect to Stanford and all that they do. Do you feel confident that people are getting the same or better quality treatment when they are in our system?
When I came to VMC, when I finished residency, that was the question that I knew my patients would ask me. Right? Like, I've got this devastating diagnosis. Am I going to be okay? Am I going to get the care that I need? Should I go somewhere else if I have that choice? And so what was very important to me when I was looking at positions after residency was as much as I wanted to be at VMC, because as I told you before, that was like coming home to me from medical school, from internship. This was the work that I wanted to do, the mission that was so aligned with, who I wanted to be professionally. But I couldn't do it in all consciousness if I thought that I was actually not able to provide the level of care that people should have. So what was really important to me was seeing what was there. As a radiation oncologist, what is the equipment? As a physician, what are the resources I might have to be able to get patients the treatments that they're supposed to get? And it was really such a relief that I could say very well and very honestly that yes, absolutely, 100% you're going to get the best care. We've got the technology, the investment in the equipment. We've got linear accelerators. These are big budget items that require major technology and ongoing maintenance and expertise to run. And we've got the expertise and the technology to really know that we're staying at the forefront, that we're not falling behind, that we're not doing less than care. And so that's been, very gratifying and important for me professionally.
Tell me about the patient body, the demographics of who we're serving, the types of cancers, the number of patients we're able to see a year.
Yes. So VMC is our sort of mothership cancer program. When I started in 2009, we had just moved into the Valley Specialty Center, that wonderful specialty building on the main campus, Bascom. As I mentioned, we are in the basement because we have to have appropriate shielding for our linear accelerators. So the rest of the infusion, rest of the cancer team, the infusion center where they give chemotherapy, immunotherapy, other sort of infusional drugs as part of the cancer care team. They were also then located down in the basement as well, because a lot of treatment requires that coordination. You might get chemo that lasts 8 hours that day, and on that same day you need to get radiation. So they just kind of get moved over for their radiation treatment while their IV is hanging. And so that type of low co-location was really important. And then on top of that was built around it an entire team, because we knew that you can give somebody the best cancer plan and the treatment that you need and have it all set up with the doctors and the nurses. But if somebody can't get to their appointments because they have a transportation problem, if they have childcare issues and they're worried about how they're going to have enough money for dinner and rent and things like that, all these barriers that has been very humbling to realize as a part of somebody trying to navigate through cancer treatment. We've got social workers, we've got dietitians, we've got navigators, all these people in place to really help get our patients through treatment. And the main focus is really making sure that these patients get full care, the care and the support they need. They've got like a whole team right behind them to help them and their family through treatment. So that's kind of how we operate. That's how we approach this the cancer journey with patients. And then it's about making sure that we have the right expertise.
Are all of our patients Medicaid recipients?
Yes. So we have, I would say, about half of our patients are Medi-Cal enrollees. And
meaning the other half are commercial insurance?
Varying other insurance. Commercial, VHP commercial is, I think, another large part. And that's why I think I like to really point out to folks is that, we treat everyone, right? So we've got patients who are, have multiple jobs trying to keep, make ends meet. They're hardworking folks who are, really rely on Medi-Cal to get the health care and the health, not only the maintenance and sort of primary care and health maintenance that they need, but also when they get sick and really need the specialist care. We've got, folks who are employees of the county and others from Covered California who have really enjoyed expanded coverage from Covered California and able to really use our services. I think one thing I really like to point out is that we have, I don't want people to just take our word for it that we're doing great stuff, but we've made a major effort to show to our community that we are providing high quality care that meets or exceeds national standards, and that's with various accreditations that we've been able to achieve. The American College of Surgeons has a Commission on Cancer accreditation. It's a national program, and we are very proud to be accredited both at VMC as well as at O'Connor as a comprehensive.
That's our second treatment center.
Yes, as a comprehensive cancer program.
We have just a couple of minutes left, and I want to talk about money. You mentioned Covered California, though that's not part of HR1. A lot of the expansions and coverage of the national marketplace exchange program, which have been renewed every year through Obama, through Biden, but are expiring now. So we're talking not only about Medicaid patients losing coverage, but Covered California patients losing coverage. And what happens? We're looking at $1 billion hole over the next couple of years in our entire budget. Right now, about a quarter of our budget is in Medicaid reimbursements. Overall, half of our county budget and half of our employees are in the health and hospital system. So even though it means ending on a down note, I would really like to hear what you and your colleagues are thinking about in terms of managing reductions of a previously unimaginable size.
It boggles the mind that we're facing these unprecedented cuts to healthcare overall, and it is to Medicaid. I understand that, but this is a time where the cuts to our healthcare system nationally, and of course, therefore, also to our county's health system, is it's dire. It's dire, and we recognize how serious it is, and have been looking at all the different ways that we can respond. Right? From our own internal work, it's always been about wanting to seek out all efficiencies and make sure that we're doing as much as we can with whatever we have, right? We're asking our doctors, our nurses, everyone to do more with less, and just to keep the doors open, to keep doing the care, and to focus very much on treating our patients and taking good care of them. But in the background, it feels like there's a fire. And we know that the health and the survival of hospitals and clinics and services are at stake and on the line. So I have a lot of gratitude for our county leadership, because I know that you guys are looking at ways of really how to make up for what's happening, outside of our control at the federal level. But at the same time, I think it's really important, as you brought up, and as I've been trying to do in my own circles and in my own community, is to really make sure people understand that this is not just about Medicaid, and not just about what kind of insurance you have. When hospitals and clinics and services are at risk of shutting down, that means everyone's wait times will go up. We have emergency rooms, trauma centers, burn centers. These are services that will be needed by anyone, no matter what your insurance is. If you have a trauma, you're going to end up in one of our trauma center. We have a level 1 trauma center. You're going to end up in one of those, and you're going to maybe have to wait or drive farther to get to that care. I mean, seconds matter in these sorts of situations, and the idea that that these services would be cut back, that they might not be there when people need it. It's very frightening, and you know, it's important for our community to understand that.
Thank you so much for talking with me. The impacts really are tremendous, and of course, not only to our public hospital system, but to the private hospitals within our county, because it very much is a symbiotic relationship. For sure. And stress on one will create stress on another. I will be talking about HR1 for at least the next couple of months as we move toward really having to address all of these impacts. I wish you continued success and support, and this is first and foremost what we do. Our county provides health care to everyone who needs it. So thank you. Thank you for everything that you do. I think I'll take you up on the field trip offer. I have no idea what a linear accelerator looks like, but now my curiosity is piqued. So
I love it.
Maybe we will do that in the near future. I will be right back. So I want to share just one more thing today, and that is that I have finally become a sports fan, and that is all thanks to the Golden State Valkyries. This is an expansion team of the WNBA. Last night, they clinched a playoff berth, becoming the very first team in WNBA expansion history to get a playoff spot in their very first year. And I'll tell you, it could not have come at a better time amidst all of the work and stress and seriousness of life right now. I am finding that I absolutely lose myself in watching women's basketball. And although I am late to the sports fan culture, I am so glad to be here now. And that's just one more thing.